Welcome to another episode of Issues and Insights. I'm Bryce Shoemate from Hardin County Government, and you all know from watching the media, and we've been laughing a little bit about, not we're laughing at the media, but we've been laughing just a little bit before we started the interview today about things that you all are hearing with what's going around with COVID, the spike that we're seeing right now. And so because all that is going on, we wanted to make sure that you all stay well informed. And I talk to you all about every time that we do an Issues and Insights that our main goal of Issues and Insights is to keep you informed on what's going on all over this great community that we call Hardin County. So today we're very blessed to be able to have two great folks that are here to talk to us. And, you know, we want to make sure that you all are getting the information that is factual and not something that someone has made up, something that somebody has, gosh, what's the word I'm looking for, has made it just sound more than what it is. In other words, they're embellishing what is being said. And I was trying to think of the word, and I couldn't think of that word. I'm from Vine Grove, so sometimes big words are hard for me. So I would like to introduce our panel today. And Dr. Godfrey from Baptist Health Hardin is here with us today. And Terrie Burgan from Lincoln Trail Health District is here. And both of them experts in their field of what's going on in our local community. And so I want to welcome both of you all and tell you thank you for taking time out of your all's busy schedule to be here with us today.
Thank you for having us.
And, you know, I would like to start, Terrie, with you. Mm-hmm. We look at what's going on, and one of the questions that we talked about beforehand is, what's the most recent COVID-19 numbers that you are seeing in Hardin County or the Lincoln Trail Health District right now?
Okay, so this data is as of yesterday at 4 p.m., okay? So total cases, and this is from the start of the pandemic, 29,000, so we're almost reaching 30,000 cases. 2,200 active cases within the district. If you look specifically at Hardin, total cases since the pandemic is 13,484. Active cases is 1,116.
And when you say active cases, that means that's the cases we know about, because there's going to be cases that we may not know about because they haven't been to a medical facility to actually be diagnosed, correct?
That is correct, yes.
And that's kind of sometimes I think about the scary part, because those are people that maybe don't know they have it, and they're out here walking around folks that haven't had this and haven't had inoculation, and that's part of our spread, you know, yes. Part of our spread scare.
Yeah.
Dr. Godfrey, you're seeing this at the hospital, and God bless both of y'all. You're seeing a tremendous amount of patients.
Yes. And thanks again for having us, because we feel like we can't spread this message enough, and just getting out to the public what we are seeing and experiencing. And if I could start with where we sit today and then maybe backtrack
Please.
To where we were at our low point several months ago when we thought COVID was going away, and I could just share what our numbers are. So today we have 230 total patients in the hospital. That by itself isn't that extraordinary. We've hit numbers that high many times in the past. Our average census on any given day is typically 175, 190, maybe up to 200. So we're seeing a little bit of an uptick in the total number of patients. But what's different is we have 97 COVID patients. So of that 230, 97 of those are COVID positive. This morning, 22 of those patients were on ventilators. If you think, well, relative to the 97, that's not that many, we typically have a 20-bed ICU. So we have had to expand our ICU capabilities. So again, as long as the hospital's been here, 20 beds in the ICU. We've expanded to overflow ICUs in 2 different areas, adding an additional 10 ICU beds. We are also taking care of these critically ill patients in our recovery units, and we have shut down our outpatient surgery so that we are standing prepared to put critically ill patients in our operating rooms. We're still doing elective surgeries that don't require overnight stays, and we're doing everything we can to continue that capability. But as of this morning, I mentioned 22 patients on the ventilator. We have an additional 5 or 6 that are critically ill, and they are also in the intensive care units, and they are teetering on needing a ventilator to support their breathing. And it's just kind of a scary time, to be honest. Some of the things that we've done to try and expand our capabilities to care for these patients, we've petitioned the state and been granted an ability to expand our bed capacity by 36 total beds. Many of you may know that we have an inpatient nursing facility that on paper functions just like a nursing home in the community.
Right.
We typically will discharge a patient from the acute side of the hospital into that nursing facility, typically for short-term rehab. We've petitioned the state and been granted the ability to change that temporarily to acute beds. So we're going to take advantage of those 15 beds to be able to take care of these sick patients because we have the physical space to do it, and we didn't want something like a state license to stand in our way. So we're doing everything we can to expand that capability to take care of these folks. Now let me take you back to where we were at our low point in June. So June 24th, we had 4 COVID patients in the hospital. 2 of those were in the intensive care unit. At that time, we really weren't monitoring vaccination status, pro or con. We were just taking the patients. At that time, our total number of deaths that we had seen due to COVID at the hospital had been 133. So then July 4th, kind of a pivotal point, and everybody remembers the 4th of July. 9 COVID patients in the hospital. We had 3 of those in the intensive care unit. Since our low point, we had 1 additional patient pass away, a total of 134 patient deaths due to COVID. Our positivity rate for testing was 5% at that time, meaning of all the COVID tests that we perform, 5% of those were coming back positive. And that's kind of a threshold for the state that kicks you into different categories. So below 5%, you're doing pretty well as a region. Above 5%, it's starting to get a little more heated. At above 10%, you're definitely have a high prevalence of illness in your community. So then move forward to the beginning of August 1, we had 37 COVID patients. So 4 to 9 to 37. Of those 37, 8 were in the intensive care unit. We added an additional 10 people passing away during the month of July due to COVID, and our positivity rate for testing went to 14%. Move forward into the beginning of September. So today we have 97 COVID patients. 27 of those were in the ICU. We have added an additional 31 people passing away. So pretty significant during the month of August. Our positivity rate for testing is around 19%. So it is hugely prevalent in our community. Everybody that is contacting this illness in some degree is coming up positive, it feels like. And so we are trying to do everything we can to figure out this testing. How do we get people tested that need to be tested? One of the things that we have done, we've typically been running our pre-surgery testing out at our previous surgery center out at 108 Financial Drive.
Yes.
So we've made a decision to open that up further, expanding the hours, adding days, and people can just drive up, drive through. They don't need an appointment.
They just show up.
They just show up. And so
Give that location one more time for our people that are watching.
So 108 Financial Drive. For those familiar in Elizabethtown, it's out by the Cool Spring Shopping Center, what we call our old surgery center. We're not doing surgeries there right now because of COVID, but we're doing testing there.
And that takes no appointment, folks. You all can drive right up.
And ideally, we would like people to have an order from their clinician because that helps get that result back. If people don't have a clinician, one thing that they can do is do a televisit, tele-urgent care visit. You go to the Baptist website, you sign up for MyChart, and after doing that, you're able to register for an urgent care visit by telemedicine. And that can generate a COVID order if you need it, and then you can just go anytime to get that test. So it's a pretty easy way to get tested, we think.
Dr. Godfrey, and I want to ask you and Terrie both this question. We have been inoculating folks since late December now, and that's late December of 2020. Why is it, especially when you just gave those numbers, why is it so important for folks to get inoculated? Because we were talking before we started this show about folks that haven't gotten inoculated and how important it is, and we're seeing those numbers that we see of people getting this variant, the Delta variant. Why is it so important for people to get this inoculation?
Yeah. So the natural life of viral illnesses is they will evolve and they will seek out that crack in the armor. And in our population of people, it is basically seeking out the unvaccinated, the at-risk person, people with suppressed immune systems. And when it finds that host to live in, it takes over, makes them sick, and in some cases it kills the individual if it doesn't make them critically ill.
So when you look at these numbers, Terrie, again, importance for people to get vaccinated.
So just to add what Dr. Godfrey said, the other thing that happens when a person is unvaccinated, it allows the virus the ability to mutate. That's one of the reasons we ended up with the Delta variant. It either weakens, the mutation either comes out as a weakened version of the virus, or it can come out stronger. And in the case with the Delta variant, it came out stronger. Yes. We know that it's more contagious, it's more transmissible, and we also know that this is an epidemic that is occurring in unvaccinated individuals. So getting that vaccination allows that when COVID comes in contact with a vaccinated individual, it kind of helps to stop it in its tracks. It reduces the likelihood of transmission. Individuals who are vaccinated are 3 times less likely to develop COVID. The vaccine is not 100%. So we have had, and I want to say this, we've had a lot of individuals who've had symptoms thinking, oh, I'm good, I'm vaccinated. If you develop symptoms, you still need to make sure that you get checked and make sure that you're okay and are not spreading it. But the vaccine helps to reduce severe illness, it helps to reduce hospitalizations, and it helps to reduce deaths. Very important that you get vaccinated.
And that's very important for your all's facility right now, because it seems to be, and I hate to take this term from the media, but it seems to be a pandemic now of the unvaccinated.
It is. And Bryce, what we're seeing at the hospital, on any given day, we're seeing about 80 to 85% of our COVID patients are unvaccinated. About 1 to 3% have received 1 dose of vaccine, and somewhere 15 to 18% on any given day have received the full complement of their vaccine.
But they are not as sick, Dr. Godfrey, they're not as sick, the ones that have been vaccinated, as the ones who have not been vaccinated at all.
Correct.
Is that correct?
And when I speak with our docs that are taking care of these folks, they're saying that those who are vaccinated typically recover more quickly, have a shorter hospitalization. They're typically not ending up in the intensive care unit. They might be hospitalized, but they are not ending up in the ICU. And when I look back at the initial studies that were published for these vaccines, they were demonstrating very similar ratios of vaccinated to unvaccinated in that study population. So I find it really interesting that our real world data is kind of lining up with what those studies showed.
And Terrie, we're talking about Baptist Health Hardin and what they see a typical day of battling this disease, this virus. What does it look like at Lincoln Trail Health District as far as a daily with what you all see?
So you know that we cover 6 counties. Right?
Correct.
But I think what a lot of
people don't. When the people that are watching are thinking you're truly the quote-unquote health department of the county, that you're
Uh-huh.
not covering all this area. It's quite an area.
It is, and we have less than 80 employees that's doing this for 6 counties. And so what usually, we have kind of changed our mitigation strategy to kind of help to prevent people from entering the hospital. So out of our 6 health centers, we are vaccinating and we are providing testing. People are really looking for those rapid testing. We don't provide that. It'll be a 2 to 3 day test. You have to have an appointment. You don't need a doctor's order, but we provide the PCR out of the health center. So what typically happens is that our phones start ringing before 8 o'clock in the morning. We are averaging about 2,900 calls a day. People having questions about, basically their questions are, what do I do? And we've been educating that from the beginning, but people who maybe not, it wasn't really on their radar, are now starting to tune in because I think of the Delta variant. We have about 5 people answering phones, and we have faxes, names coming in on the fax. So, like for example, Monday we had 600 cases that we processed, but there were hundreds of names on the fax that we couldn't get to. So when you look
and
at
when you say that, you're talking about people that have been exposed to the person that was positive, correct?
I'm talking about positive cases.
Right. Oh, okay.
That we could
okay.
not process. The labs came in. So when you look at, Bryce, at the 1,116 that I mentioned earlier, those are the active cases that we know about because of what you mentioned earlier. And then the other problem is that the ones that we haven't gotten to yet, we haven't had the ability to add that to that numbers. So we are at this point about 7 days behind from getting the lab to us in the first place. There's a process. Some labs process faster, some's a little bit slower. But a lot of times people will call us 24 hours later wanting to know if we have their lab, and we don't. And we tell them it can take up to 7 days. Once we receive the lab, it has to be processed by us. It has to be put into the state system. We have tons of people doing that, and then it goes to a DI. The disease investigator then will call you and then tell you how to quarantine and then do the release orders. Because we have been so inundated with cases, we are no longer doing release orders starting September the 7th.
And so by the time you all would call them, their time for being in that period of staying home and staying away from everybody, the quarantine, so to speak, that's almost over.
It is. It's almost over. We have had some also that are outside of the quarantine period.
People, I think, are confused a little bit about quarantine because CDC has set a number of dates. The governor has talked about a number of dates on TV. The media has talked about a number of dates. So if you have COVID. Is there a set amount of time, and both of you, either one of you chime in on this, is there a certain amount of time if you have COVID that you should quarantine, and then is there a certain amount of time that you should quarantine if you've been exposed to it? Maybe you didn't get it, but you've been exposed to it.
So if you don't mind, I'll start. There's a difference between confirmed, which is isolate, and quarantine, which is the close contact. And people get those confused all the time. So if you're a confirmed case, you isolate for 10 days. It's always been 10 days. 10 full days, and then you are released on day 11th. And that's how we guide our clients. If you are a close contact, the guidance just changed. All right? So what they're doing now, you have to look at if they're vaccinated or not. Individuals who are fully vaccinated, who don't have any symptoms at all, can continue to work. They don't have to quarantine. It is recommended that they get tested 3 to 5 days after last day of exposure to the case. If they have symptoms, and if they test positive, then of course they would follow the guidance for isolation.
Okay.
Unvaccinated individuals who have no symptoms are required to quarantine for 7 full days or 10 full days. And I'm going to tell you why. There's a shorter quarantine option. So if you're unvaccinated, you don't have any symptoms, the earliest that you can test, it's recommended that you test, is 5 days after last day of exposure to the case. What individuals are doing is they're testing too soon. And what we're starting to hear is that the population is starting to call that a false negative. That's not the case. If you test too soon, the viral load's probably too low, and your test will return negative. That's why we're recommending 5 days, no earlier than 5 days if you're asymptomatic. If that test is negative, if you continue to have no symptoms, you quarantine for an additional 2 days, you can be released on day number 8. If you have symptoms, it's going to be 10 days.
Okay. Dr. Godfrey.
I wish I had that kind of memory.
I mean, I was a PIO for dozens of years, and Terrie's doing very well spitting this stuff. She's had lots of practice.
That's the truth.
She did that very well because it has been a challenge to keep up on all of these different recommendations.
It has. And the general public is sitting at home going, what I do?
Yes.
And I always try and take these complex things and figure out, okay, how do we make this as simplistic as possible? I tell people if it walks like a duck, it smells like a duck, it's probably a duck. And in COVID, everybody should know what the typical symptoms are. Fevers, body aches, flu-like symptoms. And you can't differentiate it on just clinically from flu or RSV. You really cannot. But you should think, all right, COVID is rampant in our community. There's a lot of ducks walking around, so I should treat myself if I have these symptoms like I'm a little duck. And so get yourself into a isolated area or a quarantined area, away from people. Be wearing masks if you're around people that are at risk, your family member, or if you do choose to go out in public despite your symptoms, please wear a mask. And treat yourself as if you're positive for COVID.
Sure.
And that's the simplest way to think of this. And does it have a big impact on people's livelihoods and work and family life? It does. But the downstream consequence is that if you infect your in-laws, your parents, your children, what's the impact on them? And then it just is the gift that keeps on giving, because you will have multiple people in your family. This week, I got awoken at 3 a.m. To help some of our doctors through a situation. When I came in at work in the morning, the patient that we were discussing, the entire family had been treated in the emergency room, 2 grandparents, mom, dad, newborn baby, all COVID positive. And so I was dealing with a narrow spectrum of that through the middle of the night, but yet our staff were dealing with an entire family that needed hospital care. And I believe that they were all admitted to the hospital. The entire family was.
And people after I say this probably won't want to get anywhere around me, but I have been exposed dozens of times since this has happened, and I have been one of the blessed ones. Now tomorrow I'll get this, but I've been one of the blessed ones that has not had it. I've had different family members that have gotten it, but I will say this, that it is a true scare for people. You all called me. My 911 director exposed me several times in one day, and you all called me, and I had to quarantine at my house for 14 days back then. This was in October of last year. I about went out of my mind because I'm not one of those people that sits down. This is probably the most I'll sit today. I don't sit very well. And so I was literally in my yard going around going, this needs a little fertilizer, this needs a little fertilizer. And I was doing those kind of things to keep myself busy. It is a hard thing for people to quarantine, especially if you're not sick.
Yes.
But we realize that we have to quarantine people that have been exposed because it increases the risk for them to spread it to others.
That's right.
And I think a lot of people don't understand that part. Sometimes they think we're punishing them.
Yeah. And I went through a similar experience with my family. One of my daughters was confirmed COVID positive and was sick. Thankfully, she did well, but our family hunkered down together. And then through testing at the hospital for our nursing facility, my other family members were sick. I was feeling fine. I get tested for the nursing facility, and I turned positive. And I'm like, I have no symptoms.
Right.
And so we were quarantined again. And so it's a big challenge, honestly, and it impacts every aspect of your life.
And Bryce, if I may, one of the things that we're seeing quite a bit is that people don't realize that their quarantine periods can be extended. And what I mean by that is sometimes you repeat depending on how many people test positive in your household. The other thing too is that sometimes families can't separate. meaning we call separation the ability of the confirmed case to have their own bedroom and their bathroom. If you have a family that has to share a bathroom, that means that when that case's isolation period ends, the family then start to quarantine. And a lot of people don't realize that. It can really keep you in quarantine for 20 days or more.
Exactly. Had it with one of my folks at 911, and I'm like, what? They got to be 21 days, you know? And I was literally freaking out as an employer.
Yes.
But you know, once I understood what was going on, it was easy for me to understand why that length of time. It doesn't make the situation any easier because it means, as you all know in your jobs, it means that everybody else has to work harder to cover.
Yes.
And it's something that we truly can't help with all that's going on. We're quickly running out of time because this is a true plethora of information here that we have, and we've got 3 minutes remaining for our show. Dr. Godfrey, kind of closing remarks. If you had to tell people right now what to do, how to act, what are some things that you want to share with our community as far as COVID-19?
Bryce, I think it boils down to some very simple things. So we've been talking about masking, keeping socially distanced, washing hands. All that should be in effect. When you go out into the community, not saying to not go to the grocery or to go to community events, but wear a mask. Wash your hands, try and keep some feet between you and the next person. And just politely ask the other person if they're not wearing a mask and they're up close to you to say, would you care to put one on? And it's for their protection and their family's protection. And then I would strongly, strongly encourage folks to get vaccinated. It is a scientifically proven way to reduce your chance of dying, to reduce your chance of being hospitalized. And we are riding this tidal wave right now in our community, and we're not sure how many more people are going to present to our hospital as a result of not getting vaccinated.
Sure.
So,
sure, Terrie, I'm going to ask you the same thing, and I want to kind of a little segue off of what Dr. Godfrey said. Because of the age of my parents, I'm making them call in and me do click lists for them so that they can go pick up, you know. So those are kind of things. We've got 1 minute left. Our time has gone by so fast. I told you all it would go by fast. But anything real quick that we can get out to folks?
People have the power to change this. I want to stress that more than anything. This boils down really to a personal choice. We know that vaccination work. If you have not been vaccinated, please go now. Don't hesitate.
Folks, I just want to thank you all so much for what you do. And I thank you for coming on our show today so that we can get this information out. It's important that people stay informed and educated. Thank you all for joining us on Hardin County Education and Community TV, where truly you've had an education this morning on what's going on, not only in our community as far as COVID, but what to do to protect ourselves. Thank you all for joining us. Stay safe, stay healthy, and stay tuned to Hardin County Education and Community TV as we keep you updated on what's going on in this great community that we call Hardin County. Have a great day.